Hematopoietic stem cells, HSCs, are the progenitor cells that give rise to all the blood cells in our body, including red blood cells, white blood cells, and platelets. These stem cells are found primarily in the bone marrow, although they can also be found in peripheral blood and umbilical cord blood. Hematopoietic stem cell transplantation, HSCT, is a medical procedure used to treat patients with certain types of cancer, such as leukemia or lymphoma, and other blood disorders like aplastic anemia or sickle cell disease. HSCT can be classified into two main types, autologous and allogeneic. In autologous HSCT, the patient's own hematopoietic stem cells are harvested, typically during a period of remission, and then reintroduced into the patient's body after intensive therapy, such as chemotherapy or radiation, which destroys the remaining diseased cells. This process allows the patient to recover their blood cell production using their own healthy stem cells. In allogeneic HSCT, the stem cells are collected from a donor whose tissue type closely matches that of the patient. These donor cells are infused into the patient's bloodstream after conditioning therapy, where they migrate to the bone marrow and begin producing healthy blood cells. Finding a suitable donor is crucial to the success of the transplantation, and donors are often siblings, although unrelated donors can sometimes be found through national and international donor registries. The procedure for hematopoietic stem cell transplantation begins with the collection of stem cells. In the case of autologous transplantation, this may be done through a procedure called apheresis, which involves drawing blood from the patient, separating out the stem cells, and returning the remaining blood to the patient. For allogeneic transplants, stem cells can be collected either from the donor's bone marrow or peripheral blood, often after the donor has been treated with medications that stimulate stem cell production and release into the bloodstream. Once collected, the stem cells are cryopreserved until they are needed for transplantation. Before the transplantation can take place, the patient undergoes a conditioning regimen of high-dose chemotherapy or radiation therapy to destroy the diseased cells and create space in the bone marrow for the new stem cells. This regimen can also suppress the patient's immune system to prevent it from attacking the new stem cells. After conditioning, the stem cells are infused into the patient's bloodstream through a central venous catheter in a process similar to a blood transfusion. The stem cells travel to the bone marrow, where they engraft and begin to proliferate, eventually replenishing the patient's blood cell supply. Post-transplant care is critical and involves monitoring for complications such as infections, organ damage, and graft-versus-host disease, GVHD, a condition in which the donor cells attack the patient's tissues. Patients often require several weeks to months of close medical supervision, including frequent blood tests and supportive care to manage side effects and ensure the successful engraftment of the new stem cells. HSCT has transformed the treatment landscape for many serious hematologic conditions, offering a potential cure for diseases that were once considered untreatable. However, it is a complex and demanding procedure that carries significant risks and requires careful patient selection, thorough pre-transplant evaluation, and comprehensive post-transplant care to maximize the chances of a successful outcome.